Today we're going to discuss depression. There are many different types of depression, and we're going to go over just a few of them today. The first one will be clinical depression, and then persistent depressive disorder, seasonal affective disorder, and different types of postpartum depression. First, we'll start with clinical depression. Now, clinical depression is probably what you most likely hear about when people discuss being depressed. So it's also known as major depressive disorder, and it is a common but very serious mood disorder. It affects how you feel, think, and handle daily activities such as sleeping, eating, or working. And in order to be diagnosed with depression symptoms, in order to be diagnosed, you must exhibit depression symptoms for at least 2 weeks. Clinical depression is treatable with medication and/or psychotherapy. It's characterized by persistent feelings of sadness and loss of interest. You may have trouble doing normal day-to-day activities, and sometimes you may feel like life isn't worth living. And that's not something you can just snap out of. So some of the symptoms of clinical depression, as there are very many. Feelings of sadness, tearfulness, emptiness, or hopelessness. Angry outbursts, irritability, or frustration. Loss of interest or pleasure in most or all normal activities such as sex, hobbies, or sports. Sleep disturbances, including insomnia, not being able to sleep well or soundly, or sleeping too much. Tiredness and lack of energy. Reduced appetite and weight loss, or increased craving for food and weight gain, so an irregular appetite. Anxiety, agitation, restlessness. Slowed thinking, speaking, or movement. Feelings of worthlessness or guilt, or fixating on past failures, trouble thinking, concentrating, or making decisions, frequent or recurrent thoughts of death, suicidal thoughts, or suicide attempts, and unexplained physical problems such as back pain or headaches. So for many people with depression, symptoms usually are severe enough to cause noticeable problems in day-to-day activities such as work, school, social activities, or relationships. Some people may feel generally miserable or unhappy without really knowing why. Symptoms in teenagers and children are harder to recognize. So sometimes it may include sadness, irritability, clinginess, worry, aches and pains, or refusal to go to school, or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely sensitive, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. Symptoms in older adults. Unfortunately, depression often goes undiagnosed and untreated in older adults, and they may feel reluctant to seek help. Symptoms of depression may be different or less obvious in older adults, such as memory difficulties or personality changes, physical aches or pain, fatigue, loss of appetite, sleep problems, or loss of interest in sex, not caused by a medical condition or medication. Often wanting to stay home rather than going out to socialize, suicidal thinking or feelings, especially in older men. Possible causes of depression. So biological, psychological, and social sources of distress. Research demonstrates that these factors may cause changes in brain function. Hormones. Changes in the body's balance of hormones may be involved in causing or triggering depression. Hormone changes can result with pregnancy and during the weeks or months after delivery, or postpartum, and from thyroid problems, menopause, or a number of other conditions. Inherited traits. Depression is more common in people whose blood relatives also have this condition. Researchers are trying to figure out which genes may be involved in causing depression. Risk factors for depression. Depression often begins in the teens, 20s, or 30s, but it can happen at any age. More women than men are diagnosed with depression, but this may be due in part to the fact that women are more likely to seek treatment. Some factors that seem to increase the risk of developing or triggering depression include certain personality traits such as low self-esteem, being very dependent, self-critical, or pessimistic. Traumatic or stressful events such as physical or sexual abuse, the death or loss of a loved one, a difficult relationship, or financial problems. Blood relatives with a history of depression, bipolar disorder, alcoholism, or suicide. Being lesbian, gay, bisexual, or transgender, and in an unsupportive situation. History of other mental health disorders. Abuse of alcohol or recreational drugs. Serious or chronic illnesses. And certain medications such as some high blood pressure medications or sleeping pills. There are many complications of clinical depression. Since depression is a serious disorder that can take a terrible toll on you and your family, it often gets worse if it isn't treated, resulting in emotional, behavioral, and health problems that affect every area of your life. This can include excess weight gain, pain or physical illness, drug misuse, anxiety, panic disorder, or social phobias, familial conflicts, relationship difficulties, and work or school problems, social isolation, suicidal feelings, self-mutilation, and premature death from medical conditions. The next disorder we'll talk about is persistent depressive disorder. A persistent depressive disorder is a depressed mood that lasts at least 2 years. A person diagnosed with persistent depressive disorder may have episodes of major depression along with periods of less severe symptoms. It is very common, and it is treatable by medication and psychotherapy. It's often more common in females, and symptoms prior to being 21 years old is referred to as early onset persistent depressive disorder, and after 21 it is referred to as late onset. The primary feature of persistent depressive disorder is the presence of depressed mood on most days for at least 2 years for adults, at least 1 year for children and adolescents. During this period, individuals are depression-free for no longer than 2 months at the same time. And you must exhibit 2 or more of the following symptoms: feelings of hopelessness, low self-esteem, low energy or fatigue, poor appetite or overeating, difficulty with concentration and decision-making, and difficulty falling and staying asleep or sleeping too much. Individuals with persistent depressive disorder often maintain a negative view about themselves, their future, others around them, and general life events. Seasonal affective disorder. Some people exhibit seasonal affective disorder in the summer and spring months and then feel better in the fall and winter months. And one factor that can influence this is the location you live. The symptoms of seasonal affective disorder, which is often abbreviated SAD or SAD. Feeling depressed most of the day, losing interest in activities, having low energy, problems sleeping, changes in your appetite, feeling sluggish, difficulty concentrating, feeling hopeless, or having frequent thoughts of death or suicide. There are a few symptoms that are unique to the seasons depending on which type of seasonal affective disorder you have. So in the fall and winter, if you're experiencing your depressive symptoms here, it usually includes oversleeping, changes in appetite, weight gain, and tiredness. For people that experience it in the spring and summer, they often have trouble sleeping, poor appetite, weight loss, and agitation or anxiety. Causes of SAD. These specific causes of seasonal affective disorder remain unknown, but some factors that may come into play are your biological clock or your circadian rhythm. The reduced level of sunlight in fall and winter may cause winter onset seasonal affective disorder. This decrease in sunlight may disrupt your body's internal clock and lead to feelings of depression. It could also be due to serotonin levels. A drop in serotonin, or a brain chemical that affects mood, might play a role. Reduced sunlight can cause a drop in serotonin, and that may trigger depression. The next potential cause is melatonin levels. The change in season can disrupt the balance of the body's level of melatonin, which plays a role in sleep patterns and mood. Some risk factors include being female, so it occurs more often in women than in men, and being younger, so it often occurs more frequently in younger adults than in older adults. Family history: people with SAD may be more likely to have blood relatives or another form of depression. Having major depression or bipolar disorder, so symptoms of depression may worsen seasonally if you have one of these conditions, and living very far from the equator. It appears to be more common among people who live far north or south of the equator, and this may be due to decreased sunlight during the winter and longer days during the summer months. Now we're going to discuss postpartum disorders. So postpartum refers to after birth, okay? But the correct term we're going to use is peripartum, which means around birth. So that some of these disorders can happen before you actually give birth, is what I mean. Okay. So the first one we're going to discuss is the baby blues, then postpartum depression, and then birth-related post-traumatic stress disorder. The baby blues. So the baby blues affects up to 80% of mothers, and it is characterized by general worry, unhappiness, and fatigue, but it typically goes away after a few weeks. So when we talk about peripartum disorders, I just want to really emphasize this fact. Okay? It is very, very stressful to be pregnant, right? Physically, emotionally, financially, physiologically, every single way, right? And then giving birth can be traumatizing. It's very serious. It's not something to take lightly. So the fact that women experience the baby blues, right? Most women, almost all women after giving birth, makes it a very normal thing. This isn't something to be concerned about if you have it or see a friend having it, right? It is a very stressful situation. So we don't want to overstate that this is some kind of clinical disorder, but we do want to recognize that it's a stressful situation and new mothers need to be treated with lots of empathy, help, right? You want to be very helpful. So it typically goes away after a few weeks. Now, postpartum depression or peripartum depression is a mood disorder that can affect women after or right before childbirth. So it is characterized by extreme sadness, anxiety, and exhaustion. So this is the clinical disorder. Okay. Postpartum depression is very serious. It's not talked about very often, but the baby blues is not anything close to this. Okay. So it's characterized by ruminating, right? Ruminating means you focus on certain things in your past. So one example would be like remembering something embarrassing you did and thinking about it all the time, right? That would be ruminating on that event. So ruminating on things or events. Checking on the baby frequently, like an irregular amount, right? Intrusive thoughts. So intrusive thoughts could be things that pop into your head even though you don't want to think about them. And constant worry. So some symptoms of postpartum depression. Similar to the other types of depression, but some of them are directed towards the baby. Okay. So feeling sad, hopeless, empty, or overwhelmed, crying more often than usual or for no reason, worrying or feeling overly anxious, moody, irritability, restlessness, oversleeping or being unable to sleep even when the baby is asleep, having trouble concentrating, experiencing anger, losing interest, suffering from physical aches, irregular appetite, withdrawing or avoiding family and friends. Here are the ones focused on the baby. Having trouble bonding or forming an emotional attachment to the baby. Persistently doubting your ability to care for your baby and thinking about harming herself or the baby. There are no single causes of postpartum depression, but it likely results from a combination of physical and emotional factors. It does not occur because of something a mother does or does not do. So after childbirth, the levels of hormones in a woman's body quickly drop. I mean, like extremely quickly. So this can lead to chemical changes in the brain that may trigger mood swings. In addition, often mothers are unable to get the rest they need to fully recover from giving birth. So again, I want to emphasize that giving birth, you don't just go in and come out in a couple hours, right? It's an extreme situation, and it can lead to a lot of complications. So here we have a chart of levels of hormones from conception to delivery and then 2 months after. All right, so for example, let's look at estrogen, which is the purple one. Okay, so at conception, estrogen increases, and then it steadily increases all the way through delivery. And then once you deliver, it drops off almost instantly. Okay, so your estrogen decreases rapidly. Same goes for your progesterone. It steadily increases through conception. After conception, through pregnancy, and then drops down. HCG, which is the hormone that is identified when you take a pregnancy test, right? It increases, decreases, and then drops off around delivery. And then you can see, acne is usually caused by hormones, especially in women. Acne levels increase, decrease, 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 and then steeply increase after delivery. So we have a lot of these things going on behind the scenes that can cause a lot of emotional issues, make your body feel strange, different, right? You're just experiencing a lot at that time. Here are some more. So let's see, which ones did we already talk about? Progesterone, estrogen, oxytocin. You've probably heard about this, but this helps you develop relationships. It's secreted when you hug or during sex. So we have a high spike of oxytocin at delivery, and that helps you, develop a relationship with the baby. We also have relaxin, which is increased quickly after conception, and then it steadily decreases through delivery. So some risk factors for developing postpartum depression. So symptoms of depression during or after a previous pregnancy, so a history of it, previous experience with depression, a family member who's been diagnosed, a stressful life event during pregnancy, shortly after giving birth, such as a job loss, death, domestic violence, or personal illness, medical complications during childbirth, including premature delivery or having a baby with medical problems, mixed feelings about the pregnancy, whether it was planned or unplanned, a lack of strong emotional support from her spouse, partner, family, or friends, or alcohol or other drug abuse problems. So treatment includes medications. Some antidepressants are safe to use while you're breastfeeding, and also counseling. So there are 2 types of counseling shown to be particularly effective in treating postpartum depression. So the first one is cognitive behavioral therapy, which helps people recognize and change their negative thoughts and behaviors, and interpersonal therapy, which helps people understand and work through problematic personal relationships. If left untreated, postpartum depression can last for years. So it is very important that if you recognize symptoms in a loved one, or if you recognize symptoms in yourself, you get the help you need. The next one we're going to talk about is birth-related post-traumatic stress disorder, or birth-related PTSD. So this affects approximately 9% of women after childbirth, and this illness is caused by real trauma during delivery or postpartum. I want to emphasize this part. It is caused by real or perceived trauma during delivery or postpartum. So we've already gone over the difference between real risk and perceived risk, so this is the same. Okay? So if I actually experience a traumatic delivery, okay, let's say I have to have an emergency C-section or something, right? That's a real trauma occurring. But even say you're not mentally prepared for what delivery is going to be like, right? You have no idea what's going to happen. You just go in and have the baby, right? It could seem very traumatic if you're not aware of what's going to happen. Okay, or if you're not aware of how your body responds during delivery. So perceived is important. Okay, it doesn't have to be a real trauma. It can just be a perceived trauma. So some causes might include a prolapsed cord, and this occurs when the umbilical cord exits your body before the baby. An unplanned C-section. Again, I want to emphasize C-sections are a major surgery. It takes a long time to recover from them. They can be very scary. Use of a vacuum extractor or forceps to deliver the baby. The baby going to the NICU. Feelings of powerlessness, poor communication or lack of support and reassurance during delivery. Well, this can be from the spouse, whoever's in the room, your partner, the doctors, the nurses. Women who have experienced a previous trauma, such as rape or sexual abuse, are also at a higher risk for experiencing postpartum PTSD. And women who have experienced a severe physical complication or injury related to pregnancy or childbirth, such as a severe postpartum hemorrhage. This is when you have severe, heavy bleeding after giving birth. Unexpected hysterectomy, or removal of the uterus. Severe preeclampsia or eclampsia. Preeclampsia is when you have very high blood pressure during pregnancy, and eclampsia is a very rare and life-threatening condition where a woman has seizures or goes into a coma. Perineal trauma, so ripping or tearing during birth, or even cardiac arrest. Some symptoms include intrusive re-experiencing of a past traumatic event, which could be the childbirth itself, right? So just constantly thinking about your delivery process or how scary it was. Flashbacks or nightmares. These symptoms are very similar to what we think of when we think of like war-based PTSD. Avoidance of stimuli associated with the event, including thoughts, feelings, people, places, and details of the event. Persistent increased arousal. This could lead to irritability, difficulty sleeping, hypervigilance, exaggerated startled responses. So arousal in this case just means like being aware and alert. Anxiety and panic attacks, and the feeling of a sense of unreality and detachment. So in conclusion, depressive disorders have very similar symptoms, different causes, and they're treated in different ways.